After your hospital discharge, you will be followed closely in the BMT clinic by your healthcare team. After checking into the BMT clinic, your nurse will escort you from the BMT waiting area to the clinic exam room. It's very important to wear your mask to each BMT clinic visit and while in the waiting area to minimize infection risk. You may remove your mask once you are in the clinic exam room or treatment area. Your nurse will take your temperature, blood pressure, heart rate, and respiratory rate, as well as update information about how you are feeling and any issues you might have. Your nurse will draw blood samples to send to the lab to get your most recent blood counts. These blood samples are drawn from your central line or from your arm if your central line has been removed. While waiting for your blood test results to come back, your doctor or physician extender will examine you and review your current medications. You will need to bring all of your current medications in their original bottles to each BMT clinic visit. Most clinic visits do not involve additional medical procedures. However, if you need any other procedure performed by the healthcare team, such as a bone marrow biopsy or blood cultures if you have a fever, it will be done in your clinic exam room. Any IV therapy will be given in the BMT infusion area on the 3rd floor. Once your lab results return, they will be reviewed with you. Based on these lab results, you may need a transfusion of red blood cells or platelets. You may also need potassium or magnesium by mouth or through an IV. Since each clinic visit may last longer than expected, plan to be in the clinic for most of the day. Bring all of your medications and any food or drinks you might need during your visit. You are also welcome to bring any activities such as books or hobbies to your clinic visit as well. We want to make sure you stay as healthy as possible. If an issue is identified that cannot be managed in the BMT clinic, you may need to be readmitted to the hospital. Your healthcare team will talk to you about possible complications that may require you to be readmitted, such as fever, graft-versus-host disease, or nausea, vomiting, or diarrhea. It is always a good idea to be prepared for a possible readmission. If you do not require any blood products or IV medications, and your healthcare team has determined your physical exam is okay, your visit is complete. Don't forget to wear your mask when leaving the BMT clinic. You will need to make your next appointment with a receptionist upon leaving the BMT clinic. You can then return to your local housing. Phone numbers will be given to you should you need to contact your healthcare team before your next scheduled visit. We look forward to seeing you at your next appointment.
We hope that this series has helped you to learn more about the bone marrow and stem cell transplant program at UNC. We encourage you to watch the series more than once if necessary, as we realize that there is a lot of new and oftentimes overwhelming information for you and your family. Remember, you are the key to making this transplant work, and our commitment to you and your family is to work together to make this as good an outcome as possible.